what's a rotator cuff tear or an injury? I'll tell you why I'm asking you this question is because like around 10 years ago, I also had a fall while bowling, right?
Yeah.
And since then, I often like the pain subsides and it goes off. But whenever there's like a weather change or something, I feel a bit of like, okay, there's something that is bothering my right shoulder. So is that like people keep nurturing their injuries? They don't go to a doctor without even knowing that they have a problem. It can be, is that a rotator cuff tear or an injury? Will you describe it that way?
Yeah, it's a very valid point in today's date. A rotator cuff injury or a frozen shoulder, these are two terms which are commonly used very loosely for any problems in the shoulder. Now one needs to understand what exactly is a rotator cuff tendon. Now we hear a lot of guys telling that I had a rotator cuff problem, I had this problem of pain, stiffness, so on and so forth. Rotator cuff tendon is nothing else but the end of certain muscles which arise from a shoulder blade and gets inserted into your arm bone. Now, there are four rotator cuff tendons, out of which three of them are very important, called supraspinatus, infraspinatus, and teres. Now, the main function of a rotator cuff tendon or tendons is to elevate the arm or to get the arm up against the gravity. Now, whenever you have an injury to the rotator cuff, an individual has pain, an individual has weakness in the arm, and he is unable to perform his normal routine activities. Now, as you said, you had a childhood or a adulthood injury where you fell off from a bike or would have had an injury while playing a sport. So you would have had either a complete tear of your rotator cuff or a partial tear of your rotator cuff. So the symptoms a patient could encounter is based on what profile of a tear the patient has. I would also like to add on a point here. Rotator cuff injuries are not restricted only to younger individuals. Most common patients who come to us with rotator cuff injuries are geriatric age group patients. What happens in them? The rotator cuff tendon tissue becomes weaker over the period of time as they age, and one fine day with a small trivial injury, they can snap off or tear their rotator cuff tendon and have weakness in their arm where they are unable to lift their arm by themselves. This is called as pseudo paralysis. They may need to support the arm with another arm to lift, or they can struck their shoulder and try to lift their arm. So this is also one of the most common shoulder problems which people come to us with.
There's an important question here. Uh, my mother, she suffers from a frozen shoulder. So is frozen shoulder a result of a rotator cuff injury or that is separate?
A second most commonly used term when people talk about shoulder problems. I
Because
mean,
she cannot lift her hand beyond a point and then she has to go through the exercise and all and then it subsides.
okay, let
But
me
I want you being a surgeon expert on this, tell me what would you suggest?
so let me just elaborate a simple point here. Frozen shoulder means the shoulder is frozen. Now, what happens when you freeze something? It becomes tight, stiff, and immobile. A frozen shoulder leaves with a stiff shoulder, where the patient is unable to move the shoulder joint because the shoulder joint is stuck up. On the contrary, a rotator cuff tear leaves with the weakness of the arm or weakness of the shoulder joint, where if the patient is allowed to move the arm with assistance, like somebody else is moving the shoulder, they are freely able to move, irrespective of anything. A frozen shoulder can be result of a primary frozen shoulder, which is seen in individuals who are highly diabetic and in senior citizens, or it could be a result of a secondary frozen shoulder, which is related to some form of internal damage into the shoulder. So frozen shoulder per se can be either primary, which has no set particular cause. Diabetes could be a predisposing factor, or it could be a secondary frozen shoulder, which is a result of some other injuries in the shoulder. So your mother, if she is above the age of 60 years and if she has not had a injury or a fall, and if she is diabetic, then it is a primary frozen shoulder. If she is non-diabetic and if this is resulted after an injury to the shoulder.
Doctor?
Yes, yes, it could be a
Like she
primary
is
frozen
that
shoulder.
6 HbA1c 6 around that borderline.
Okay, it could be a primary frozen shoulder.
Okay. Now, what would you recommend for a frozen shoulder or a rotatory cuff tear? You recommend a surgery to get it fixed, a permanent fix, or exercises, and like you should throw some light on it.
As you introduced me, I'm a surgeon, and I would always look at the benefits of a surgery, because surgery is
Okay.
the final destination treatment for any shoulder problems. But you have other alternative treatments before you probably decide on or go in for a surgery.
Correct.
Now, it all depends on what is the expectation of the patient, what is the profile of the patient, and what is the profile of the injury. Now, if it's a young individual who's coming to us with probably a dislocation of the shoulder or a rotator cuff tear, of course, the expectations are high. The patient would want to get back to its sporting activities. He
Normal.
wants to have a quick recovery time. Then a primary surgical intervention would be the apt treatment as early as possible. Get it fixed and get going with your work. On the contrary, in elderly patients, if it is a frozen shoulder, the first modality of treatment is always conservative. We put them on anti-inflammatories, we put them on some rehabilitation, physiotherapy exercises, wait and watch. If the
Okay.
symptoms are subsiding, if they're getting better, well and fine. A second modality of treatment are some injections, either a corticosteroid injection or a PRP injection into the shoulder in kinds of mild tears of the tendon. If all these modalities fail, then of course surgical intervention is the way to go for.
Is required. How critical is early detection, doctor?
See, a stitch in time saves nine. This is a very old saying, and it holds good for anything, especially in medical sciences. The entire logistics and entire finances and effort becomes less when a problem is detected primarily, when it is detected in the early stages. I mean, say for an instance, if you have a small rotator cuff tear, if it is detected early, it could be prevented from leading on to a massive tear. When we try to ignore it, push the pain beyond certain limits, think that it may subside by its own, I don't think it's a great idea, especially in today's date when you have so much of medical facilities available all around. You have so many good doctors, so many good hospitals. You have diagnostic modalities like MRI and CT scan, which can precisely diagnose your problem. And when you have specialists like us who can might as well treat your problem specifically, I think it's always better that you take a consult from
I
a.
was reading lot of patients' reviews and all, and they were so happy with the suggestions that you have made.
I would put it the other way around. Neglected rotator cuff tears lead on to an early arthritis of the knee joint, of the shoulder joint. Like any other joint, if you have an ACL tear in the knee joint, and if it is neglected, if you have a meniscus tear in the knee joint and it is neglected, likewise, if you have a rotator cuff tear in the shoulder joint, if it is neglected over the period of time, the shoulder joint loses its integrity. It loses the normal functionality, and then the wear and tear process is just speeded up. That's osteoarthritis.